The Public Health Agency of Canada has just released its first report since it began conducting psychological operations on the Canadian public. Let's dig in.
Behavioral science is now the first line of defense for our health system.
We have our own applications too that nudges people or reward them for healthy behaviors or giving them badges or these kind of rewards.
The Government of Canada is a strong proponent of behavioral science as part of an interdisciplinary approach to improve the health and well-being of all.
Under the guidance of Chief Medical Officer of Health Theresa Tam, who also serves on various World Health Organization committees, the Public Health Agency of Canada has developed a behavioral science office, and it's just released its first report on the art of how to persuade compliance with whatever they deem necessary. The report begins with a brief land acknowledgement and then aims to highlight that the Public Health Agency of Canada's, I'm going to call that PHAC, progress in establishing the Behavioral Science Office, I'll call that the BSIO, from April 2021 to March 2023. Launched in the spring of 2021, BSIO recognizes the significant role human behavior and decision-making play in achieving public health goals and improving health outcomes for Canadians. They said this wasn't easy, but the new unit provided the rapid advice and deep dive evidence needed to support the Government of Canada's pandemic response.
Governments have had to persuade their populations to accept new behaviors and conditions, all in the context of rapidly evolving evidence. As part of our transformation, we created a new unit for behavioral sciences to integrate evidence about why people make the decisions they do into our programs and policy work. The idea came from Dr. Elena Altieri. Where is Elena? Is she here? Can you stand up so people can see you? In response, the idea came from Dr. Elena Altieri in response to my invitation to all staff to propose crazy ideas to make our organization more effective and efficient.
That clip was from Director General of the World Health Organization, Tedros Ghebreyesus, at the final strategic roundtable that's part of the World Health Organization's talks in May of 2022, where he gave opening remarks around behavioral science for better health. Since BSIO has joined forces with the Office of the Chief Public Health Officer, the World Health Organization, the Organization for the Economic Cooperation and Development, and the Behavioral Insights team, to name only a few, it's important to be prepared for these crazy ideas coming down the pike. Theresa Tam confirms this collaboration was used here in Canada at that same World Health Assembly Strategic Roundtable on behavior science for better health. Look at this.
The European Regional Office and for putting out this tool, the COSMO or COVID snapshot monitoring tool. I don't know if any of you have used it yourselves, but we definitely had a really good go at this and learned a lot from doing waves of study. It's a longitudinal study, tracking and monitoring the public's knowledge, their risk perceptions, their behaviors, their trust in the public health officials. And we did 16 waves of this tracking, and they're published on the Impact Canada site. But we also incorporated some randomized controlled trials in some of the waves. So you can do a lot with the application of some of those methodologies. And so now we have quite a good database, for example, for tracking the evolution of behavior and behavioral science during this 2+ years. We use some of the insights, such as the relationships in terms of the beliefs in misinformation and compliance with the public health measures. And so our tools address misinformation. Some of them was derived from our COSMO surveys, and including ways to empower local trusted messages to help with providing accurate information, online social media platforms, online games to debunk misinformation on vaccines, And we also use social norms, the application of the insight on social norms in one of our campaigns called My Why vaccination campaigns, where people post why they got vaccinated, and it became a very normalized approach to vaccination. For me, protecting my parents is my why. Of course, keeping myself healthy and getting back to things that keep me fit, connected, and having fun are runners up.
Why? Because all of our vaccines are not 100% effective, just like there's no drug that's 100% perfect. So for us to all be protected, we need everybody across the globe protected and immunized against COVID.
My why for getting vaccinated is that I want to get back to cycling outside with my friends and the post-ride socializing.
This new unit says that it's indebted to the incredible staff of the BSIO, as well as PHAC's data, surveillance, and foresight branch, formerly corporate data and surveillance. The report is signed off by Heather Devine, director and co-founder of the Behavioral Science Office, and Dirada Economy, former acting executive director at the Center for Integrated Insights. Interestingly, the rest of the behavioral science team is completely elusive. While Partner Impact Canada has a listed behavioral insights team, neither of those two individuals from the Behavioral Science Office appear on that page, showing that the government is utilizing behavior scientists in far more avenues than public health sector alone. And it's all happening in a pretty secretive way. The report goes on to define behavioral science as a multidisciplinary approach to the study of human behavior and decision-making, combining findings and methods from psychology, neuroscience, and other social sciences that consider how psychological, sociocultural, and systemic factors influence the context and environment in which people make decisions. Understanding the diverse barriers and motivations for decision-making enables practitioners to design and test solutions that drive demonstrable and meaningful impacts on behavior-based outcomes. It was formed after a needs assessment was conducted in April 2021 by then Minister of Health Patty Hajdu, recognized the critical role of human behavior in public health. Creating BSIO introduced innovative and experimentation function within the branch to support PHAC's revitalization as a world-leading data-driven public health organization. It would appear that one of their first tasks was the May 2021 memo titled Testing Behavioral Sound Messaging in Response to Severe Adverse Events Following Immunization, where messaging and communication around COVID-19 vaccine injuries needed to be framed in a way that did not compromise the government's safe and effective marketing slogan. Faced with mounting public distrust in public health after its grotesque failures in pandemic handling and response, in its first year, BSIO aimed to address priority areas such as vaccine confidence, public health measures, combating mis- and disinformation, border measures, and public health communications to inform key pandemic response activities. In its second year, BSIO expanded its focus to new areas that emerged as critical to PHAC's mandate, including climate change and infectious disease, mental health, and antimicrobial resistance. This new office says that an increasing number of countries are using behavioral science to enhance health outcomes, and it can help address challenges by understanding human public health. Behavioral science helps address human decision-making tendencies to predict how people will respond to programs and policies, identify barriers to health-promoting behaviors, and likely sway them into compliance, design programs and policies that align with how people tend to think, feel, and behave, evaluating interventions to focus on meaningful behavioral outcomes for better future strategies. The priorities of the first 2 years of this brand new bureaucracy that delivered 11 deep dive research projects, 50 plus requests for rapid advice, recruited 10 behavioral science fellows, delivered 10 plus training sessions, enlisted an additional 308 PHAC BSI community of practice members, and released 63 newsletters and publications, included COVID-19, respiratory infections, public trust, antimicrobial stewardship, childhood immunizations, mental health, public health measures, climate change, infectious disease, and chronic disease. The emphasis is clearly on integrating behavioral science into public health initiatives. The report outlines how this new office came after the World Health Organization developed the Behavioral Insights tool to help countries monitor public knowledge and behaviors related to the COVID-19 response. The WHO says that one of the most critical elements of reducing virus transmission is public behavior. In terms of what's to come, BSIO is leveraging their research to understand Canadians' intentions to follow public health measures, conducting studies on mis- and disinformation, and public trust, including PHAC as a source of public health information, and continuing behavioral insights research on other priorities beyond the pandemic, like, eating bugs and how to be a good climate citizen. They confirm that in the next page. Project areas include antimicrobial stewardship, childhood immunizations, mask wearing, mis- and disinformation, mental health, infectious diseases, healthy living, and climate change. They will modify and shape your perceptions and behaviors using the impacts model, which identifies how behavioral science can be applied to the policy challenge, maps how to target and change the behavior, prototypes that change, act on the plan to test its effectiveness, and then scale it. Some of these spotlight efforts include routine childhood immunizations during the pandemic, which brought in the Vaccine Behavior and Confidence team of PHAC to support the catch-up and success of routine childhood immunization programs.
I think, coming back to evaluation and science, I think it's important when applications are being stood up that there is an actual integrated evaluation and research aspect to them. Otherwise, you have no idea whether they work or they don't work. So maybe government can at least play a role in that space. We've certainly seen a growth of these applications, and we have our own applications too that nudges people or reward them for healthy behaviors or giving them badges or these kind of rewards. And I don't see people doing that research as much as we would like. So maybe I'll turn it back to chief science officers to see if they can help. But I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
This nudging of compliance is also known as coercion. And with the use of behavioral science, it's all being done subliminally, subconsciously, so the general public isn't even aware that they're being manipulated. Experimentation on individuals without their explicit knowledge or consent undermines personal autonomy and trust, calling into question the ethical implications of using behavioral science in public policy. So as the agency ramps up their trust initiatives, maybe they should let everybody know the extent to which they're using behavioral science techniques on the public. Transparency is crucial, and the public deserves to be informed about how their thoughts and actions are influenced, especially as the agency spends millions of your hard-earned tax dollars to shape your behavior. For Rebel News, I'm Tamara Ugolini. You can check out all of our reports on the World Health Organization and its various initiatives at exposethewho.com. At that website, you can also chip in to consider supporting this kind of journalism if you appreciate it. That's exposethewho.com.